Dr. Christina Francis is the CEO of the American Association of Pro-Life OBGYNs, better known as APLOG. She joins us now to talk further about the abortion pill and why it is just so dangerous.
Yeah, thank you so much for being here. We appreciate it. Let's talk about that. I know you have seen patients who've taken the abortion pill. Tell us about, what they've gone through, what they've experienced, and how you were able to help them.
Absolutely. Well, so I work as an OB hospitalist, so I just work in the hospital taking care of patients that maybe come in through the emergency room. And I myself have cared for women who took the abortion drugs and then suffered tremendous complications. There's one woman in particular who stands out in my mind. She was a young mother, had another baby who was still very young and, wasn't ready, she didn't think, to have another baby. So she ordered these pills online. She was able to do that because of the reckless actions of the FDA in removing the in-person dispensing requirement. So she ordered the pills online. It took them 2 weeks or so to get to her. So she was 2 weeks farther along in her pregnancy. And then she took these pills and suffered, as I said, many complications. She did not pass all of her baby and the pregnancy tissues. So she had retained tissue. She had bled so much that she required a blood transfusion. And she had a severe infection that required IV antibiotics. And then she had to have an emergency surgery to complete her abortion. And, she had ordered these pills online. No one had given her appropriate counseling. No one had talked to her about these risks or even given her other options of what she might have been able to do in her situation. And this is not uncommon. My group has taken care of several women in very similar circumstances, and many of our members at APLOG from across the country have had similar experiences caring for women with really severe complications.
Yeah, it's so tragic too, because you see many pro-abortion groups, Planned Parenthood, saying these are very safe.
Right.
Well, and to that point, there was a recent study in the United Kingdom that so many women are unprepared for the amount of pain that they're going to experience. And of course, in society, it's sort of sugar-coated. Mm-hmm. Can you talk more about that?
Yeah, absolutely. Well, as you both said, that women are told these are as safe as Tylenol. Mm-hmm. It's just like taking an over-the-counter medicine. And they think because they can do it at home, that it must be safe and easy. It's anything but. Women experience severe pain. These drugs put them into labor. So they're going through labor at home, oftentimes alone with no support and very minimal pain control. Of course, I don't prescribe medications to induce an abortion, but one of the medications, misoprostol, can be used to treat miscarriage. And when I use that in my practice, I sent women home with narcotic pain medication because I knew that their pain was going to be so severe. So it's so important for women to understand this is not just a heavy period, which is what they're often told. Not only from physical symptoms that they experience, which is, like I said, labor, but also the mental health aspect of this, that they are going to deliver their baby at home and likely see their baby.
Yeah, part of that sugar coating comes from the media.
Absolutely.
There's a lot of peddling of false information and outright lies about this drug, aren't there?
Yeah, absolutely. Well, some of the ones I said, it's just as safe as Tylenol. It's just like a heavy period. Women go through this all the time. It's not going to be a big deal. You can take these drugs, it'll be over with quickly, and you can move on with your life. When in fact, we know, like I said, the physical symptoms are severe. The mental health effects that we're seeing are tremendous. And the abortion facility now gets moved into their home, and they can't ever get away from that. So it really is a travesty. It is wreaking havoc for women as well as the children whose lives are lost because of these dangerous drugs.
Yeah, absolutely. Our sister station, the Catholic News Agency, has been tracking where the abortion pill is legal. And all states that you see right there in red are where it's legal. And in yellow states, the abortion pill is limited, but still available. Even the states in green where it's supposedly illegal, women are still able to get this drug via the black market. Talk about the dangers there.
Absolutely. Well, there's so many dangers associated with these drugs at baseline. But then when you take away that in-person doctor's visit, to me, that's saying women who are seeking abortions, they deserve substandard care, because then we're not screening to know how far along in their pregnancy they are. The farther along they are, the worse those complications are going to be. We're also not screening for an ectopic pregnancy, which happens in 1 in 50 pregnancies. These are not uncommon, and they can kill women. And these drugs do not treat ectopic pregnancies. So this is very dangerous for many other reasons as well. The other thing I think that's important to point out is now that the FDA has removed that in-person dispensing requirement and these drugs can be dispensed online, now it honestly doesn't matter right now what laws states have in place to prevent abortion, because this completely circumvents every state law in the country. You know, we've heard some people recently, and certainly during this election cycle, say this decision should be left to the states. The problem is the FDA essentially issued a federal mandate that overrides every state law, and it really is a problem, not only from a policy standpoint, but also for our patients.
So if a woman regrets starting a chemical abortion, she can get what's called an abortion reversal, right?
So yes, there is a miraculous option that's available called abortion pill reversal. And all it is giving women natural progesterone, a hormone that their body makes anyways, that is crucial for early pregnancy. And what it does is it competes with the abortion drug mifepristone to allow progesterone to have the action in supporting that developing baby that it's supposed to have. It doesn't work 100% of the time, but if a woman changes her mind after taking the first of the 2 drugs, which we know many women do, many women that I've talked to, I've treated women and had successful reversals, which is so amazing, one of the best deliveries I've ever done. But if women change their mind and start the progesterone quickly after having taken that first drug, right now with the data that we have, about 70% of the time we can save that baby. And there are now more than 5,000 babies alive because of the miracle of abortion pill reversal, and more than 5,000 women who were spared the loss of their child and able to have a lifetime with their child.
That's wonderful. Dr. Francis, thank you so much for coming on. We appreciate it. Always great to see you.
Thank you so much. It's great to be here.
We'll see you later on this
All
afternoon,
right. Absolutely.
too.
Absolutely.